Oh, no worries.
Good morning. Apologize for the late start. We've had some technical difficulties at our end this morning, and we're ready to begin. I'm Zan Ojiro, this year's board chair, and I would like to begin with the land acknowledgement. We are on Kalapuya lands of the Ampinipu and Chemaho bands of the Kalapuya, who were displaced under force to reservations in the Coast Range after the Willamette Treaty. And the descendants of these peoples are still with us today. We continue to honor the lands and the systems, ecosystems here with our actions as we can. With that, I'm going to pass the baton for introductions to Commissioner Wise.
Nancy Wise, Commissioner and Vice Chair.
Pat Malone, Commissioner.
Vance Cronin, County Council.
Eric Michael, Board Recorder.
Adam Lawrence, IT Director, and acting capacity for County Administrator Joe Kirby.
Okay, with that, I think that we will jump into the rest of our agenda and do introductions as we go. Are there any announcements this morning? Okay, hearing none, we will then move on to comments from the public. And I know that we have Jules Cooper with us this morning, so please go ahead. Good morning. And I do want to remind you that we want to take no more than 5 minutes for comments this morning.
And do you want me to speak now?
Please do. Welcome.
Okay, good morning. So, I'm just going to read. I have already submitted to Teresa some pictures, and as well as what I'm going to say. We're not asking board of commissioners to change any laws. We're asking them to adequately finance county offices so that they can enforce existing laws. Benton County Code Enforcement needs more than one half-time officer to enforce codes and regulations that are already backed up by law, but not by enforcement. The Benton County Sheriff's Office needs a better route for communication with community members who are coming to them with a problem, a complaint, a concern, or a legal matter. It is confusing to be told by a Benton County Sheriff officer that we are living during unlawful times and that they are too short-handed to be bothered with an illegal marijuana grow, and to be told that the evidence lockers are all filled up so that they can't do anything about illegal marijuana growth. It is also confusing to have Benton County Sheriff officers as well as detectives call us on our private cell phones, on their private cell phones for work-related matters, and it is a practice that produces no record of their calls. During our 6-month-long struggle with the myriad issues going on next to our property, we've been given personal cell phone numbers of detectives, state police, Benton County officers, and that's just wrong. There needs to be a single comprehensive office or agency where citizens being affected by illegal marijuana growth can get all the answers and not have to deal with so many agencies. Benton County needs one clear set of rules and regulations covering all hemp marijuana growing in the county that will protect adjacent landowners, public waterways, public roads, property owners' wealth, as well as kids in nearby schools, delineate exactly who is who. Marijuana has been legal for 5 years in Oregon, and yet code and regulations for grows in the county still not developed. Other counties in our state, Deschutes County, have their regulations in place upon legalization. What is taking Benton County so long? Could it be that they just don't want to regulate the grows? The permitting of THC and CBD grows is handled by 3 different agencies. There's the OLCC for recreational marijuana grow, the ODA for the hemp CBD grows, and the OMMP for medical marijuana, making it a losing proposition for landowners to find out if a nearby grow is legal or not. The OMMP growers are shrouded in secrecy, and adjacent landowners as well as law enforcement officers are left in a gray area because of this. The growing of THC marijuana passed off as a medical grow is challenged only when law enforcement can find a legal reason to come onto a grower's property and take samples. Unpermitted grows make this virtually impossible for law enforcement. Being the permit is what gives them the right to come and check. That's a problem. This breaks down clarity for law enforcement, for the public, and for code enforcement, making it easier for each type of road to continue unpermitted, unchecked, outside of the law, outside of taxes, regulations, and environmental protections. It helps foster a black market of illegal weed growing that takes from Oregon and thus Benton County residents but gives nothing back in return. Why do we want this? To shine a light on illegal grows and discourage them and not make it easier because that's what's easiest for us. When the Bushes were cited by the Oregon State Police for poaching on Gerald Bush's property, OSP Officer Zach Cochran phoned me and said Gerald Bush was livid and told him he would retaliate against us. Cochran told me he replied to Mr. Bush, well, don't do anything illegal, and Mr. Bush said he wouldn't. But Gerald and Sam Bush did. The Conex containers that have sat stacked too high and too long across the back of our property since late January are against code and without the needed permits. If the state and Benton County want to encourage citizens to turn in poachers, then they need to back up whistleblowers when they are retaliated against and not pass the responsibility off to counties where the poaching has happened. The state needs to work with the county on incidents in which state officers make an arrest and there is illegal retaliation. We have felt 6 months of retaliation and would never turn a poacher in again, ever. Just how serious are the state and Benton County about catching poachers? Are we dealing with a group of law enforcement officers who are poachers themselves and are therefore reluctant to enforce any anti-poaching laws? Did we learn the lesson that they wanted us to learn? Don't call. When the poaching incident happened back in January, my husband and I were alerted to it by the sound of a ricochet bullet off of old farm equipment that was sitting behind our house on Gerald Bush's property. We saw a car we had never seen before idling at the end of his driveway, and we saw several vehicles idling up on Pitt Road behind our house. People were running down from the vehicles into the pasture while shooting their guns. One of the elk cows died, but the other one was just injured and kept trying to get up for about 5 minutes. Finally, one of the shooters went over and shot it at close range. We phoned the Benton County Sheriff's Office, and then we phoned the OSP. The Benton County Sheriff's Office came to our door after talking to the people and said everything was fine, it was just the property owners. But when the OSP arrived, they issued citations and told us that tag buy-up had taken place and they confiscated the elk. Why the differences in ways of dealing with the same problem? What does this say about the Benton County Sheriff's Office? The Bushes are people who believe they are above the law and can do anything they wish on their property. And if you call them out on it, the problem isn't that they broke the law, the problem is you. So they don't take responsibility for their actions, and the lack of follow-up by law enforcement when they retaliate against their neighbors tells the Bushes that they're right to do so. We are planning to sell our house this spring and had to wait, missing out on one of the best real estate markets of all time because of the grow and the Conex containers. Hunting on land that is strewn with metal farm equipment, suspended metal irrigation lines, and close to houses puts us all in danger. We have no proof that we are in danger, though, until a bullet comes through our house or kills one of our loved ones. Our neighbor is obviously not a skilled or professional hunter. Hunting in wide open spaces makes perfect sense, but hunting near homes and into metal farming equipment is unwise and unsafe. Yet it persists due to a lack of regulations or laws to fix this problem. Our house has been here since 1882, and it is not a house that has just been plunked down recently, creating a new problem. I thank you all respectfully for listening to me. Have a good day.
Thank you. Really appreciate your comments. And the whole marijuana issue, marijuana hemp, cannabis complex is so complicated and frustrating to all of us. We are very reliant on our Association of Oregon Counties Council, who is an expert in this arena and has been trying and pushing to streamline legislation, but it certainly doesn't help you because it's not there yet. So I'm hoping we can get there and sooner rather than later. I appreciate you raising the issues that you have, and we will do what we can.
Thank you.
Thank you. Is there anyone else who wishes to make public comment this morning?
This is Steve Harder. I'd like to make a comment.
Go for it, Steve.
Thank you, Commissioner Ojero. I'll be quick. I just wanted to comment real quickly on the current efforts of dial-a-bus in and out of the current pandemic milieu, and just to sort of update the commission and anyone else who's listening on what we've been doing. Since the beginning of the shutdown last March, Dial-A-Bus has contributed $16,000 of its own money towards COVID mitigation procedures. That includes cleaning materials. Someone else called.
Jules, would you mind turning off your mic? We're getting some feedback. Thank you.
Thank you. $16,000 private money, none of it was public money, towards COVID mitigation processes. That includes cleaning materials, plexiglass partitions that were installed in county-owned buses as well as Dial-A-Bus-owned vehicles. We were happy to do it. We thought it was extremely important given the vulnerability of our clients. We continue to work with the local homeless coalition to this day, making sure homeless and home insecure folks who are spread throughout the county are able to access hygiene services, food services, medical services, are able to get to laundromats and so forth. We're still doing that. In fact, we've got a bunch of guys headed over there right now. We're also working with the food bank to make sure their more vulnerable clients are able to access food by actually taking the food to them rather than have those people leave their safer homes and places of living to have to come out into public. That's still going on. We're working tirelessly for Title I kids who would be on free and reduced lunch programs at schools to make sure that their families have food and cleaning supplies that they would normally access at schools, but since those schools and those summer programs have largely been shut down or moved off-site, they're still difficult to access for a lot of folks. We had a couple of sort of special things that happened, and I'll be done here in less than a minute, Commissioner. A couple special things happened this past month that we're kind of proud of and that we're privileged to be able to do here at Dial-A-Bus from time to time. And in partnership with the Oregon State Athletic Department, I personally was able to bring 16 young women from the area, all of whose families are navigating poverty, to the OSU Women's Golf Center and to meet with some of the female athletes and the coaches, all of whom are unbelievable female role models. And they got a golf lesson and got to interact with the athletes. And for every single one of the girls that I brought over there, that was the first time they'd ever set foot on a golf course or held a golf club, much less interacted with a Division I athlete. So that was kind of a special moment that we got with our connections with Oregon State University. We also had the privilege of taking a hospice patient whose final wish was to get to see the ocean one more time. We were able to take that patient and his family over to the coast for about 3 or 4 hours on a really nice summer day where there's very little wind and give him his final wishes. That was a special moment that we had. He passed several days later, and according to his family, it was very peaceful passing, and he was thankful for that to the end. We, of course, that family was also navigating poverty, and we did that with our own as well. Lastly, we had a family from South Carolina who had a loved one who passed out here. That family's church community back home did a GoFundMe to get them plane tickets to come out here for the interment. That was great, but they didn't have transportation when they got here, so Dial-A-Bus chipped in and we went down to the airport, picked those folks up, drove them around town for the weekend to make sure they could get where they wanted to go and got back safely to the airport so that they could properly say goodbye to their for a lot of the people that were there was their great-grandfather who came to Oregon and passed peacefully too. So those are just some of the things that are going on at Dial-A-Bus. All of those things are privately funded with donations and grants, and we're going to continue to stay committed to serving the people of Benton County in those ways and through our contracted commitments for your time.
Thank you, Steve. Appreciate all that Dial-A-Bus is able to do with donations and grant and contract services to serve the rest of the community beyond our state and federal funding that comes through the county. Okay.
Thank you.
We're going to move on and review and approve the agenda. I don't have any changes at this time. Are there any other additions? Nope. Okay. We will move into our work session. And the first item of business is an update from our Department Operations Center for COVID. Suzanne Hoffman and April Holland will be, I think, the principal people, but there are several others from our health department with us online today.
Great. Thank you, Commissioner. Good morning, everyone. I'm Suzanne Hoffman, Benton County Health Department Director. And normally we would provide our standard Department Operations Center update. Today is a little bit different. Probably heard a lot in the news over the last several days, couple of weeks, about what is emerging with COVID-19. And as you know, and as evidenced by the masks that you're wearing today, Benton County employees or visitors are now masking indoors. Thank you for that. I'm going to turn it over to April. She's prepared a presentation for you. I will jump in when we get to some information around our hospital capacity. And I know that our health officer, Dr. Bruce Thompson, has joined us to provide input today as well as a few others who may chime in. So I'll turn it over to April Holland.
Good morning, everyone. I am just getting my screen set up here to begin my presentation. Should take me just a moment. You're probably seeing double right now. Can you see the presentation?
We can see your, yes, now we can.
Great, and you're seeing the whole slide there. Mm-hmm. Okay, thanks. Good morning, Commissioners. Good morning, everyone. I'm here to provide you with an update on mostly the Delta variant. I do want to just acknowledge the touching and impressive update by Steve with Dial-A-Bus, and want to add that they were of great service in providing rides to vaccine appointments for many months. So one more thing to add to that update. So we've got a lot to cover today. Thank you very much for your time, and I'm happy to answer any questions that you may have. So I'm going to start with some goals as I see them through my lens of public health. I'll update you on what we know about the Delta variant, and an overview of the many pieces of emerging information, much of it concerning. And then we'll go over the picture on the ground in terms of what's happening here, in terms of local cases, hospitalizations, and finally some public health recommendations to help protect our communities. So in public health, we tend to define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And in my mind, some public health goals, community goals include healthy residents, healthy hospital system, and a healthy economy. Just working on forwarding my slide here. So I'll give you a brief overview of what we'll be talking about. The Delta variant, as we all know, is a strain or a mutation of the SARS-CoV-2 virus. It emerged in December 2020 in India, and first was detected here in the U.S. in March of this year, in Oregon the next month, and was pretty quiet for a little while. And then here in early July, we had our first detection. Delta's quickly just runs through the country and has become the dominant strain. OHA estimates that it's now accountable for 80 to 90% of cases here. Next, I'll go through some of the known pieces about Delta. But first, I moved this slide to the top because I want to emphasize the good news as well, and the hopeful news, and that is that our vaccines that we have protect very well against severe disease and death. We do know that they may be less effective at preventing infection or transmission, but that benefit is enormous and essential. We're going to see more breakthrough cases and more community spread despite vaccination, but vaccination is key. Vaccinated people are far less likely to be infected at all, and also far less likely to spread the virus than someone who's unvaccinated. And then the other good thing is that we can further reduce our risk by wearing a mask. On to what we know. Delta is really very contagious, approximately 3 times as transmissible than the early versions of the virus that we had seen. We are seeing that there's much higher levels of virus than early COVID-19 cases, which contributes to the high contagiousness or transmissibility. And then finally, there's evidence accumulating that Delta may come with increased severity. There's a study from Canada showing higher odds of hospitalization with Delta, one from Singapore showing higher odds of oxygen requirement with Delta, and another from Scotland showing higher odds of hospitalization. Additional concerns include the fact that unvaccinated infections will lead to increased hospitalizations and largely vaccine-preventable deaths. Due to the incredible transmissibility of Delta, we're seeing an increase in fully vaccinated individuals with infection, including symptomatic infection. We're also seeing some new information showing that the vaccine effectiveness among long-term care facility residents is lower than the general population of vaccinated individuals. We're also concerned about new information that shows that breakthrough cases or cases in fully vaccinated people may be as infectious as unvaccinated cases. We're seeing more increases in hospitalizations nationwide on the national level among young people. And then finally, we know long COVID is a real concern, and it's not yet clear if this will become an issue in fully vaccinated cases of COVID. Some equity concerns with Delta. We're seeing racial disparities among hospitalizations nationwide, and I'll share more data on that in just a sec. But I want to just touch on some of the rhetoric, some of the messaging that we're seeing nationally and beyond. When we are looking at health through an equity lens, some of the messaging is unhelpful. While it's true that cases are largely driven by unvaccinated individuals, this A includes children under 12, who constitute 10% of our population, and B, it's not a particularly helpful strategy when attempting to gain trust. And the other messaging that we've been hearing, your health is in your hands, it ignores the stark fact that the health of many individuals is not within their own control. Public health and pandemic response includes each of us and all of us. I'd like to see us get back to a community embrace in regard to COVID prevention and protection. So this is a slide, a national slide from COVIDNet, which is a surveillance system that includes 14 areas across the United States, including the Portland Metro Tri-Counties area. The decrease in hospitalizations that you can see on the chart in early 2021 was a result of vaccine rollout and ongoing masking and other public health interventions. In March 2021, hospitalizations in non-Hispanic Black communities increased nationwide and in Oregon, while decreasing in all others. During the spring, hospitalization rates increased disproportionately in Black communities and have stabilized at the highest rate of all communities. The hospitalization rate in non-Hispanic Black communities nationally and in Oregon is now 5.5 times the rate in non-Hispanic White communities, 3 times the rate in Hispanic communities, and 1.5 times the rate in American Indian, Alaska Native communities. I wanted to show this slide of our vaccination efforts so far. This shows fully vaccinated numbers and proportions in Benton County. You know, we've seen so many metrics, as I've told you all before, that it can be a little tough to know what our protection level is. So I wanted to put some actual numbers along with the proportions so that we can visualize just how many people are not yet eligible for vaccination and that number of people who are partially vaccinated or who remain unvaccinated. So you can see that we don't have really a full picture, a full protection by any means. I mentioned before that we're seeing more hospitalizations among children nationwide. We don't want to see this happen in Benton County, and we haven't so far. So here on the ground, here in Benton County, cases are increasing. State and regional hospitalizations are increasing. I'll just jump right into our case numbers. You can see the red line, the red vertical line, shows when the mask mandates were removed. And that lifting of restrictions looks like it coordinated pretty well with Delta arriving, unfortunately. The first Delta variant detection, the specimens were collected on July 1st and July 8th. And so you can see that we had a steady increase from that period onward, and this goes through Sunday. This is a last-minute addition. Our epidemiologist, Peter, provided this so that we could have a visualization. I'm sorry, the numbers are small. A visualization of recent cases by age group. So you can see that this is over the last 12 weeks. You can see that cases in all age groups have obviously increased since that trough you can see in late June. Cases among youth, which are the orange and the yellow, have increased as well, but not at a rate that's much greater than for cases overall. Seeing more distribution among age groups here. Our case rates, the OHA risk metrics, they were discontinued at the end of June. We were used to looking at things and the metric levels listed there. So that yellow line that you can see is the 50. Sorry, I have an error here. That first bullet point should say under 50 is lower. So 50 to 100. We have surpassed that lower and are well into what we used to call the moderate with the 2-week case rates. With the new CDC recommendations, we saw different language coming up since we don't have our risk metrics. This is a bit of a shift. CDC shows Benton County listed as having substantial community transmission. Substantial community transmission is 50 to 99 cases per 100,000 population in the last 7 days, or a pretty high positivity rate. And high is 100 or more cases per 100,000 in the last week, or a really, really high positivity rate. I want to let you know that our CDC data is a little bit behind, and our new 7-day case rate for the past week is going to be 110, so Benton County will be illustrated as red in coming days. Importantly, we need to keep an eye on how our regional hospital is doing, as COVID has the propensity to have a serious impact on the services that we can provide here. The hospital had been sending census information of COVID patients and those in use ventilators in use for COVID patients. There was a break in the data that I received, but I wanted to just show you that when they started providing information again, the cases are as high or higher than, this is 15 cases reported yesterday, higher than any of the numbers I had, which go back to mid-December when I came to Benton County. So it's important to remember that the Benton County numbers are important, but we live and work and get care as a region, and we've got to understand that our regional medical center is navigating staffing shortages, an increase in COVID-19 patients, and a diminished ability to discharge patients to long-term care. I want to stop for just a minute because I think that Suzanne may have some information to add here.
Thank you, April. I spoke with Laura Henham, CEO of Good Samaritan Regional Medical Center last Friday, and at that point in time, we had 12 positive COVID patients hospitalized, 2 of whom were on ventilators. And she was concerned that they were headed toward their all-time high during the height of the pandemic, which was 15, and of course we are there now. Laura also explained that yes, our hospital is in Corvallis that serves the region. Some of the most seriously ill people who are hospitalized in our region come to Good Samaritan Regional Medical Center. So aside from that, though, really what's happening statewide with hospital capacity affects our community hospital system too. For example, St. Charles, a hospital in Bend, has gone to emergency-only status through at least August 4th. So they are not taking any elective surgeries or any procedure that would result in an overnight stay in our emergency-only status until August 4th. And part of that for them, as I understand it, is that they don't have the capacity in long-term care facilities to be able to transfer people there that they normally would. And there are also issues in other hospitals around the state. So what happens is where hospitals may transfer a patient that could be best cared for in another setting, which happens routinely around the state, there's an inability to make those transfers right now in some cases, or there's a delay in making those transfers. And so it is an exercise in creative staffing every single day for our hospital, who's, like all others, experiencing staffing challenges to determine how to best care for people who cannot be moved, and how to potentially open their doors to patients from other communities in order to accommodate everyone, while still accommodating our local community, and those challenges continue to increase. Laura expressed that, the three main factors that she could see driving what's happening for them are obviously the increasing number of COVID patients being hospitalized here at Good Sam. There's an increase in other kinds of emergency department admissions as well, which is creating challenges for capacity. And then the staffing and the inability to transfer as many patients to long-term care facilities as they normally would. She's very supportive of the community making efforts to stay safe in ways such as masking up. This is the time to exhaust all efforts to prevent increased transmission. And there are a couple of things she said that are very quotable from my perspective, so I'd like to share them. Because, for anyone who perhaps is tired of masking or just doesn't understand why we still need to do it when there is a statewide mandate from the governor, it's easy to apologize for perhaps overreacting. Than it is for underreacting and having to apologize for some very negative and painful outcomes. Also, pointing out that masking is some of the best and cheapest insurance that we have. It's a very easy thing to do, and it's a preventive measure we can all take. She expressed her support for the leadership of the county and whatever actions we're able to take to help keep the community safe and help to preserve our hospital capacity in the coming days. She also offered to provide updated information or, if available, even come speak to this body as we move forward on this effort. That's what I have, and I'll turn it back over to people.
Thank you so much for that, Suzanne. So on to what we can do to help protect our community. Due to the high transmissibility of the variant and the large number of people still unvaccinated, community transmission is likely to further increase without intervention. Masking indoors is something that reduces the risk of infection by about 70%. I've often said that we need to use all the tools at our disposal: vaccines, testing, case investigation and contact tracing, and non-pharmaceutical interventions such as masks. Indoor masking is easy, and it will reduce transmission. If enough people are vaccinated and are also taking precautions such as wearing a mask indoors outside of their home, even a contagious variant like the Delta will hit too many dead ends eventually to continue spreading in the population. And I love Laura's quote that it's some of the best and cheapest insurance that we can have. Just want to cover a few things that are happening out and about. As we know, CDC and OHA issued recommendations to mask indoors. The governor's directed OHA and ODE to require masking in K-12 schools. Various cities, counties, and at least one entire state reintroduced mask requirements. So was Louisiana last night. As employers, Benton County and the city of Corvallis are requiring indoor masking as well. I just want to add that it's also encouraging to see that many businesses have reinstated masking requirements indoors as well. And it's something that is well within their rights to do. In closing, I take this one a little personally. No one wants COVID to be in the rear view, more than those of us who have been in nonstop emergency response mode for 18 months. Thank you to our teams who work ceaselessly with such passion. We're all tired. We really have to keep this up, and it's important to remember that getting vaccinated isn't just about you. It's about protecting the people around you. when a person's vaccinated, they're much less likely to spread the infection to an older person or someone who's a transplant recipient or a cancer patient who may die from the infection. Please help protect our community and our children by masking up indoors, even if you're vaccinated. Before I stop, I do want to leave a few minutes for our health officer, Dr. Thompson, to say a few words. Dr. Thompson?
Good morning. Thank you, April. Appreciate the opportunity to speak to the board as well. So my concern, I support everything that April has put forward. All of this is changing almost on a daily basis as new data come in. And so we must change and to provide the greatest level of protection that we can within Benton County. I want to speak specifically regarding schools. Just quoting from Governor Brown, my priority is to ensure our kids are able to safely return to full-time in-person learning this fall, 5 days per week with minimal disruptions. Quarantine is not a minimal disruption, it is a maximal disruption. So we want to not have to quarantine cohorts of school children. Going on with Governor Brown's quote, with many children still ineligible to be vaccinated, masks are an effective way to help keep our kids safe in the classrooms, in the learning environment we know that serves them best. So on Friday, we met with, our schools team met with 509J School District, and they were very happy to hear that the masks are required for all in school to be wearing masks. So there are many of the school kids are just not able to be vaccinated because they are under the age of 12. And they need protection from the virus in other ways. The masks are just simply one way. In the U.S., more than 4 million children have tested positive for COVID, and children actually represent 19% of the reported weekly cases. In the past 2 weeks, nationally, there's been a 3% increase in the cumulative number of child COVID cases. And for many states, up to 20% of the total COVID cases are from children under the age of 12. And up to 18% of children being tested are positive. It is highly likely that these numbers represent an underestimate. So in addition to being public health officer, I used to be a family physician and provided obstetrical services to our patients, as well as naturally newborn care and pediatrics services. And one of the ways that we provided safety to newborns who were not able to be vaccinated for whooping cough was to make sure that everyone in that person's environment that newborn's environment was vaccinated. It's called a cocooning strategy, where you build a cocoon of protection around the newborn so that they don't get whooping cough. Whooping cough is a nuisance for most of us adults, but in reality, it causes death in newborns, and about approximately 20 infant deaths per year year are due to whooping cough. So in terms of keeping our schools open and meeting the governor's goal of an uninterrupted school year, there are two strategies. It is masking, and fortunately we now have a mandate for that. And the other is to vaccinate as many people as possible in the population to protect those children who are not able to be vaccinated because there simply is not vaccine for them. So that is my ask at this Board of Commissioners meeting, that rather than the somewhat concerning your health is in your hands message that April pointed out, a message that our health is in your hands might be an appropriate message for our community. That is all I have at this time. I'd be happy to answer questions if there are any.
Thank you, Bruce and April and Suzanne. It's all very sobering news, not surprising necessarily, but very sobering. And I hope that people in our communities will indeed heed this new advice to mask indoors wherever they can, because it will protect all of us, especially those who cannot be vaccinated for whatever reason, whether age or anything else. So thank you. Are there questions from my fellow commissioners? Pat has a question.
Yeah, I'm not sure who to address this to, but on the under 12-year-olds, what's your estimate for when they are likely to be eligible for vaccination?
Hi, Commissioner. The latest we've heard is midwinter for eligibility for those youth. Some data needs to come in from clinical trials, and then it has to be evaluated. The ACIP committee with the FDA will, with the CDC and FDA will meet, and then that emergency use authorization will be granted. The initial data will require follow-up data due to children being involved. Now, having said that, that estimate of midwinter could move with new information. So I'll keep my ears open for all of us.
Great. And Dr. Thompson, I appreciate your trying to work on messaging. Did I hear you correctly? Our health is in your hands. Is that your, did I hear that correctly?
Yes, it is, Commissioner Malone.
Because I think from all the information that we've gotten this morning, what my takeaway is we have emphasizing vaccines and indoor masking, and it sounds like those are the two main tools in our toolkit to see if we can get things back to where they were a month ago, which we can call the good old days now of July or late June. So any further thoughts on what our message to the public should be?
It's hard to see us overusing those two very effective tools.
I think this is a little different number. You said Benton County is 63% fully vaccinated. What age group is included in that statistic?
I'll let April clarify that.
Thanks. So that figure of it's 62.6 as of yesterday. Vaccinated with the 2 doses if they had a 2-dose regimen and 1 dose if it's J&J. That's for all of the county. So we want to, that's our ability to look at our overall level of protection. In the slide I shared before, I wanted to give us that visual of the number of people fully protected, that piece of the pie who can't even get vaccinated yet, and then the other piece of the pie who are either not done with their regimen or haven't been vaccinated yet for whatever reason.
Follow-up, are the people that are in the 2-shot regimen showing up for the second shot at 90-95% receive the second shot, so we can, I think earlier we were including those in the statistics because the show-up rate was so good. Is that still the case?
Yes, we still do have good return rates for the 2-dose regimens. It's higher than 95% for Benton County. Not everyone's going to be included as having their 2 doses because there is some proportion of those people who haven't returned, that 5%, and then we also have people who are waiting for the timing for their second dose. But yeah, we're doing well with it, and the reason that I like to look at fully vaccinated is because we're looking at a whole new ballgame with Delta variant. 1 dose is not nearly as protective as having 2 doses plus the 14 days.
All right, and last question. I think April, you mentioned the long-term care folks, and that there was some slippage in the people that are fully vaccinated. That I guess could you clarify that? Does that mean they were vaccinated in 4, 5, 6 months since they've been vaccinated, that the vaccine is not as effective as it was a couple months ago?
Sure, those are great questions, Commissioner. The information I shared with you about vaccine effectiveness in long-term care facility residents, that's emerging national data. I don't have specifics on the timeline of vaccination and when those individuals may have been infected, but you may have heard various conversations nationally happening about perhaps providing additional immune protection to our most vulnerable citizens. I'm not sure if that's going to happen. Information is, as Dr. Thompson said, evolving many times a day. So we'll keep you up on the latest as it comes to us.
And you didn't use the word booster shot, but is that what we're trying to figure out if that's needed and who might need another shot?
That's right. Did you have something to add, Dr. Thompson?
I did. I thank you, April, Commissioner Malone. I also want to just say that these vaccines are incredible vaccines. There has never been vaccines that have provided the level of protection that these vaccines have. There is, it no doubt will be the way forward for vaccines. I would be surprised if it's not. And in addition, as with any vaccine, while we try to immunize the most vulnerable elderly group of us, and I include myself in that, I suppose, because of chronic medical conditions, it is evident historically that above a certain age, our immune system's ability to maintain good immunity from a vaccine that has been given does wane. And so I think that what we're seeing with our long-term care facility residents is that well-documented waning of effectiveness of a very effective vaccine. And yes, booster shots may be the next step.
Okay, and this isn't a question, but I just really appreciate your efforts through this marathon, and I'm proud of that Benton County has taken the COVID seriously from the beginning, and I think we have the statistics, whether it's death rates or vaccination rates, that because of a coordinated effort, we're in relatively good shape, and really appreciate the frontline people doing what you do. So thank you.
Well, we couldn't accomplish it without the great community members that we have, that we share this space with. So thank you all.
Thank you. Got a great team. Okay, are there any other questions for our health folks? We don't have any other decisions to make today. I am glad that we've made the decision to return to masking indoors. Hope that will protect us and our communities.
Thank you.
Okay, then we will move on. The next item of business is a total shift in direction to discuss proposed floodplain code revisions. We have Toby Lewis and Greg Verrett from Community Development with us for item 4.2.
Okay, hi. So, Toby Lewis, I just wanted to, So, we are in the process of updating our floodplain ordinance. The update is being triggered primarily by the 5-year audit of the floodplain program. We go through an annual audit, small audit every year, and then once every 5 years we have a large 5-year audit. This time there have been some alterations to the community rating system program that have required different, or that are requiring different language in our code relating to how, relating to the elevation of mechanical, electrical, and plumbing equipment when people are building new structures or making additions or upgrades to their structures in the floodplain. The county is also in the process of, or has an open community assistance visit with the state. And that community assistance visit identifies whether or not our floodplain program is compliant with all of FEMA's minimum standards in the National Flood Insurance Program. Right now, the state doesn't have the capacity to finalize that community assistance visit. It's basically another audit. It's just with a different agency. But one of the requirements when we do have successfully finalized that will be that we make some additional adjustments to our floodplain regulations that FEMA has required since the last time we went through that process. So we're combining both of those audit requirements and making all of the adjustments at once. The floodplain code adjustments that we're making are primarily required. It's a lot of administrative language. It's a lot of adjustments to definite things like that. But there are a few different adjustments or additional adjustments that we have an option of making, and I'll talk about those in a minute. The reason for bringing these up here is just because there's a lot of stuff, and I wanted to make sure you guys have a chance to look at the code ahead of time. We do have a hearing scheduled for August 17th. The Planning Commission had their hearing and recommended approval, or recommended adoption of the adjustment. That was on July 20th. So the attachments in the agenda checklist, there was a table of code changes that kind of goes through what the numbering is in the new code versus what the numbering for the same information is if we already have it in the existing code. The numbering on the second attachment of the draft code changes, or draft chapter 83, is not finalized. We're still working on that. That'll be done by the end of the week, is the goal. And there are some changes that have been made since the packet was submitted. So it's not anything huge. It's just moving a few things around mostly. And then the third attachment was the existing code for chapter 80. So we're just scrapping that one and doing a complete rewrite to match the model ordinance that the state provided. It helps with when our code is reviewed, then the people at the state can see more easily that our code is compliant instead of having to dig through it and potentially missing items as they go through. So we've brought all of the information from our existing code that we're allowed to keep. That's all in the new code. And then there are a few items that we weren't allowed to keep that it would have required to change in some way. So we've done that. The fourth attachment is just the minor changes to other chapters, and then the fifth attachment is just fixing the term floodplain in chapter 57. So going back to the proposed code, that's 2. The biggest thing that we're adjusting that we have permission to mess with is just a clarification of the requirement for when people are dividing land or moving property lines in Benton County. So that's in section 5.1.9.2. It's titled Parcel and Lot Design Standards. Our code currently says that when you're dividing land, you need to maintain a suitable and adequate building area outside of the floodplain on each resulting parcel. Typically, since we put that in our code, I think it was in about 2011, we have typically considered that to be about an acre or so of land needs to be kept with any given piece of land that you're creating. The wording suitable and adequate is very subjective. It doesn't identify any specific parameters. So it actually triggered an additional type of review for property line adjustment that didn't really need to be there. But because we didn't have anything that was very clear about what suitable and adequate meant, we had to put that in there. So in the proposed code, we've identified a specific minimum amount of land that has to be maintained with each property. We're proposing at least 10,000 square feet of land outside of the flood hazard area for each parcel, not less than 50 feet in any given dimension. The thinking behind that was we're trying to get a general idea for how much, how much land you might need to build a house, plus hopefully site a septic system in there. Typically, it's better to have a couple acres to do all of that, but this is meant to be the bare minimum that we would expect to see to ensure that somebody can reasonably site a house on a property. We certainly encourage people to reserve more land outside the floodplain, but it's just meant to be a really small minimum amount to start with. By identifying specific square footage and dimension standards, we can remove the requirement for the administrative reviews for property line adjustments and just make those ministerial reviews because the standard is either you need it or you don't. And there's no guesswork as to what that size is. The other thing that we are doing is relaxing the dry land access standard when people divide land. So our code currently says that if you're dividing land and part of it's in the floodplain, you have to make sure that each piece is served by a driveway that is located entirely above the flood hazard area, above the height of where the flood would rise to. That was flagged by the state as a potential problem and a definite concern because it encourages filling in the floodplain if your land is too low to create that elevated driveway, and it also has the potential for creating some dikes or berms or whatever you want to call them when you create that elevated driveway, which will back up water onto other people's property and cause more flooding. So it was requested very strongly that we remove that. Our comprehensive plan has a statement in it that we need to be making sure that emergency vehicles, basically making sure that emergency vehicles can access the site. So we couldn't remove that standard entirely, but we did relax it a bit to require that if your access from the road, like where you're going to put your driveway from the road to your building site, is going to be lower than the flood elevation, that you need to submit a profile showing the ground elevation along that driveway and the flood elevation. And then you also need to sign a covenant acknowledging that you understand that your driveway will be underwater during a flood event, a 100-year flood event, and that emergency vehicles may or may not be able to get to your property, and you may or may not be able to get from your home to the road during a flood event. So that was the compromise that we came up with. The state said they were okay with that. It still makes sure that we're putting property owners on notice that that access to and from their building site might not be available during flood events. So we're making sure people are still aware of the hazard of having their driveway there. But we're also not requiring adding fill in a way that would negatively impact the function of floodplain. Any questions on that one before I move on, or any of what I've said before I move on to the next? Sorry.
I can foresee situations in which it would be perhaps desirable to place a culvert or a bridge in a driveway run in order to avoid that impassability situation. But of course, that makes everything more expensive for any owner who is developing their land. But it certainly is an option. So I think that it makes sense to also keep that in mind and encourage people to do so.
Yeah, and the way the code is written, it does still allow for people to do that if they choose. So, I mean, the process for doing that would be to apply for probably a conditional letter of non-provision through FEMA to document how the flow of floodwater would change if we installed a bridge or a culvert like that. And then once they've installed it, then to apply for the letter of non-provision to finalize that. Okay, so the next, that was really our big one. The next item would be accessory structures. So our code right now requires that all accessory structures are elevated so that the floor is 18 inches higher than the flood elevation. We were required to put that into our code, I think it was in 2011, due to changes in FEMA's requirements and thoughts about accessory structures and variances and all kinds of stuff. We used to, before 2011, we used to allow accessory structures to be built at grade if people choose, and just built with flood vents in the wall to allow water to flow through the structure over the floor during flood events. The information from FEMA has changed recently, and they are now allowing accessory structures to be built with that wet flood-proof construction, so the venting that allows the water to flow through the structure under certain conditions. So it's allowed for accessory structures that are not more than 600 square feet in size, not more than 1 story tall. They have to be on the same parcel as the primary structure. Those are the key sideboards on there. So I've added that back in, and to go back to what we were allowing before. If the structure is more than 1 story high, or it's larger than 600 square feet, then it still has to have the floor elevated to 18 inches above the floodplain. But it's nice to be able to have the wet floodproofing option in there for the smaller structures. It has to be for things like parking, storage, and access, so no human habitation. So it's not accessory dwelling units, it's not extended living space, it's just like garages and shops that are standalone structures. In addition to that, there is also new guidance for agricultural structures. FEMA is finally recognizing that there are a lot of agricultural structures that are built on farm properties, and a lot of those farm properties end up being in the floodplain. So we are allowed to authorize agricultural structures, meaning structures that are being used in association with some type of farm use. They're not offices, they're not places where the public or employees are spending large amounts of time, but there are things like barns and equipment storage, buildings, those types of things. Those can be built with that same wet floodproofing standard without the 600 square foot maximum size on them, as long as we authorize them specifically through a variance process. So we've changed our minor variance process to be specific to agricultural structures. That change was made at the direction of the state, and it should help with allowing those structures. Any questions on either of those two? Okay. What is not, so all of that is already, I'm sorry, I don't know how to make the phone in the background stop ringing right now, but it'll ring for a few minutes, or a few rings. The other changes that are not in the code section that you have, that was submitted as attachment 2, but came up since the agenda checklist was prepared. Section 4.3.2.2, floodplain development permit exemption. I tried to get those in there as, so our code right now says that that people, for those types of things, people are required to submit a floodplain development permit. And then at the county level, we can deem those activities exempt from floodplain regulations. So basically, they just don't have, we don't have any floodplain regulations that would apply to them. So there are things like small amounts of fill for like garden boxes or a sandbox, minor improvements to a dwelling where it's an in kind of place. So if somebody has a water heater that needs to be replaced and it's too low to meet the standards, rather than having to elevate it, as long as they're replacing water heaters with the same size and type and capacity, they can leave it in their basement, stuff like that. So rather than saying you have to apply for a floodplain development permit for these things that often we wouldn't even know about, and then we can tell you there aren't any floodplain requirements, I changed it as a proposal to say these items are exempt from floodplain review. And then the information that I got back from the state this week was that that isn't going to work. It has to actually go through floodplain review in order to make that determination. So I've changed that back to the way it's worded now. And then the next item would be fences. So that was also a new change this week. When I was talking to the state floodplain coordinator, she said that, so fences right now are addressed in section 5.1.8. We have some wording in our language, in our code right now that says, if you're building a fence, you should really make it an open wire fence. It shouldn't be solid construction. It should allow water to flow through it. It's more of a recommendation than a requirement. And I added some language in there based on some new information that will more clearly define what types of construction are allowed and what types aren't. And then in my conversation with the state floodplain coordinator this week, she said that FEMA has relaxed their stance on fences a bit, so they're really only concerned about fences in the floodway. So I've taken that section 5.1.8 out of the regular floodplain requirements and moved it down into the floodway requirements for suggestion. And then the only other section that got moved was 5.1.10, that's interpretation of floodplain boundaries and use of other flood data. That just got, it's the same information that just got moved to a different section in the code. So, are there any questions about that?
No, I know that this is not fun stuff, but essential.
Yeah.
So,
go ahead.
No, go ahead.
I was just going to say, I don't really have a lot of other information. I just want to make sure that you guys have a chance to look at this before the hearing, because I know it's a lot of information, and again, some not super exciting, but helps us get to where we need to be, and it helps us maintain our current ratings, the computer rating system. So.
And I'll just add that while it looks like a lot of change, and in a way it is, we are taking our entire floodplain chapter and setting that aside and adopting an entire new floodplain chapter. A lot of the content remains the same, it's just moved around or reworded or reorganized to be compliant with the state model code. But that has taken a lot of work. So we're having to move very quickly on this because of the deadline imposed from outside. So bear with us, and if you notice a typo here or there, feel free to point that out, but understand that most likely why is because we're doing Toby is doing a huge amount of work in a very short period of time. And yeah, and I'm just trying to keep up with her. So together we'll get this through. But and there may be things that come to light after it's adopted, excuse me, that we need to correct here and there. And if so, we'll do that. But I don't think we're going to. Not going to miss anything major. I think we have enough eyes on it between our staff here and then the state floodplain coordinator that I think we'll end up in a solid position once we get this adopted. So thank you for working through it with us.
I do have one question, and that is the treatment of greenhouses and floodplains. Is that going to fall under the ag structures provision?
That'll fall under a lot of things. So depends on what the greenhouse is made of. So first it falls under the definition of structure. A structure for floodplain purposes, floodplain regulation purposes, is a structure, a building that has a roof and 2 or more solid walls or rigid walls. So if the greenhouse is made of that visqueen, super flexible, basically, flimsy plastic, or not flimsy, but, super flexible plastic, then it's not even considered a structure and it's not required to be elevated. If it has 2 or more rigid walls and a roof, then it's considered a structure, and then we look at whether it can be determined to be an accessory structure, meaning it's not taller than 1 story and it's not more than 600 square feet. If it is, then it could be wet flood proofed without a variance, and they could move forward that way. If it's more than 600 square feet or it's taller than 1 story, I can't think of any greenhouse that would be taller than a story, but so if it's more than 600 square feet and it is being used for agricultural purposes, then they could apply for a variance for each agricultural structure that they want to place, so that it could be wet flood proofed. So it does open up some options instead of just elevating.
Thank you. Okay, any other questions? Nope, not at this time. Okay. In terms of the public hearing moving forward, how is this typically advertised, and do you expect that we will hear from many people? I know that many people get very frustrated when they have to deal with this particular section of our code, but what do you expect in terms of community input?
So we haven't had any responses yet. Alyssa put it on some social media posts and sent out a press release about it. Because we are not making any of our standards more restrictive than they than they already are, we're not required to notify everybody who owns land in the floodplain. So we did not do that. We're hoping that the social media and the press release were enough to at least get it in front of people. We really didn't have time to do the public outreach that would have been nice to do, just because of the timeline that's been posed by the audit. In terms of how restrictive the code is now, we're actually, we're not, like I said, we're not increasing how restrictive it is. We're actually relaxing several standards and allowing some more options. And I haven't gotten any comments. We did send out notice to all of the citizen advisory committees, and we sent out notice to all of the fire districts because we were changing those dryland access standards for dividing rooms. And I didn't get a response from any of those groups or agencies. The reason we didn't do a full notice, we're not required to notify everybody in the floodplain, but the reason we didn't do it was partially because of the compressed timeline, but also because that's about a 2,000-piece mailing.
Yeah.
And it's really hard to put that together. And it just wasn't going to be possible on the timeline that we had.
Thank you.
So we will be holding the public hearing in 2 weeks, and as we've mentioned a few times, the timeline has us just getting in under the wire if we hold the first reading in 2 weeks and the second reading 2 weeks after that. So if anything comes to your attention as needing to be addressed, anything substantive, please let us know as soon as possible. The Planning Commission reviewed it, as Toby mentioned, and made some corrections. So hopefully we can get through in the next 2 meetings.
Thank you.
All right, thank you.
Okay, with that, we have come to the end of our, no, let's see here.
Do we need a motion to?
Do we need a motion to proceed to public hearing? Sure, if there's a motion, please do.
I'll move to direct staff to proceed to a public hearing on it's August 17th with the code as proposed and as may be modified by the state.
Second.
Any further discussion? All in favor, please signify with an aye.
Aye.
Aye. Okay, thank you for that. Okay, we are now going to take a break. We have 2 public hearings and the consent calendar to address. And what I would like to do is come back at 11 for a time certain and work on the consent calendar and then move forward with the public hearings. So we have a 30-minute break. We next have on our agenda our consent calendar. Do I have a motion for approval?
I would like to make one change to the joint board meeting for July 1st. So I'd move to approve everything else.
So everything but 5.3?
Yes.
I'll second that.
Okay. All in favor, please signify with an aye.
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 Okay, now let's turn to item 5.3, the July 1st, 2021 joint city-county meeting minutes.
So just a really quick, small change it's on page 6 of 7. It's under the number 5 crisis response. So we were all referred to by our last names except for Hyatt in just that one blurb. So I would just ask to change Hyatt to Lytle. And then do I move to approve with that change?
Sure.
Second.
Did you catch that, Erica? Thank you. All in favor, please signify with an aye.
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 Aye. I missed that. Okay, moving on to our public hearing number 1 in the matter of public hearing approving a special use permit for Shrewsbury Renaissance Festival. And we have staff with us to present that. Leanna and
Chair, I have a brief statement on this one. I live in the neighborhood. I know some of the parties involved, but I feel like I can be objective in this hearing.
thank you. So noted. Okay, Leanna and Jesse.
Good morning, everybody.
Good morning.
So here we are. We never received any feedback from the public. So I don't have anything new to share other than just their permit for their next 5-year request.
Okay. So no further details from staff or any changes. Is there anyone who would like to make public comment? Hearing no public comment. Are there any comments by commissioners?
Hope everyone has fun and is safe.
Excellent. Okay.
I do have one question for Leanna. Leanna, how many years has the Shrewsbury Festival been coming to the Benton County Board of Commissioners for approval? It seems like it's, what are we pushing, 18 or 19 years now?
18 exactly this year. If they had had it consecutively, it would be 18. But technically, this is their 17th year if they didn't have it last year.
Thanks.
Okay. Well, I will now close the public hearing, and I am ready for a motion.
Okay, I'll move that a 5-year social gathering permit application number 21-001 be approved, subject to established conditions and requirements.
Second.
All in favor, please signify with an aye.
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 Aye. Okay.
Wow. That's a far cry from the first couple of hearings.
Very true. Thank you so much, everyone.
Thank you. Okay. We are now moving on to public hearing number 2. And that is with respect to amending Benton County Code regarding contracting. Vance Curry.
Thank you, Chair. As you all are well aware, the contracting code needs to be updated to realign our contracting code, which is Benton County Code Chapter 2, with the contracting manual that you approved several months ago. The contracting manual really does refine and detail our internal processes, but as part of the development of that contracting manual and work with a number of departments, we identified areas of the county code that also need to be changed and need to be updated. I just want to touch on a couple of those just so that you're aware. Going down to on the overall page 158, you will see that item 15 is a good and services agreement. This used to be our old personal services contract. There is a type of agreement, a personal services agreement that allows governments to enter into a contract with a contractor without any kind of process. When I got here years and years and years ago, that same process and the name of our contract were the same. And they've been the same for 20 years, and it's confusing. So we are going away from the personal services contract and going to a goods and services agreement to distinguish between the process and the document. Just something that I had been thinking about, and departments all agreed, why is it taking us so long to change it? Okay, fine, we'll change it. So that I think is going to be a good change. On the next page, along with that, is the item 22, which is, again, change the material and services contract price agreement. It more accurately reflects what the document is. I can't tell you how many times I've had to describe what a material and services agreement is, just because it's not obvious from the name. So just trying to make it a little easier for both internally and for contractors receiving that document to understand what they're being asked to enter into. I want to move now to page 160, that's the next page, all the way down to item 2.210. We still have our breakdown of price thresholds which describe how we enter into certain types of contracts. If we're entering into a contract under $15,000, there's no process required. If we're entering into a contract whose value over the life of the contract is $150,000 or more, you have to do a request for proposal, the full-blown formal process. It's this intermediate process between $15,000 and $150,000 where the vast majority of our contracts fall. And we have not been very clear over the years on how to enter into those contracts. As a result, we have had different departments sort of going through processes that were unique to that department. Not that they were wrong, it's just that over time they had drifted. So this is an attempt to tighten things up and make our contracting process for that intermediate group of contracts more consistent, clearer. But when I say consistent, it does not exclude the third point, which is a little bit more flexible, and I'll describe that in just a second. So within this range of $15,000 to $150,000, if a department is going to purchase goods, things, rebar, or computers, if the value of that purchase is between $15,000 and $75,000, they can solicit oral or verbal quotes. We've always been able to do that. State statute allows that to happen, but up until this year, we've allowed verbal quotes up to $150,000 and for any kind of agreement. Tightening that down to say if you're going to get a thing or a group of things, goods, you can only do that up to $75,000. That's the only type of intermediate process where you get 3 quotes verbally, is for that small segment of purchases. For all others, for things or goods, 75,000 to 150, or if you want to purchase services or services and things, you have to get 3 written quotes at least. The other thing we've done is for purchases between 75,000 and 150,000, in the years past, we had been limited to selecting a vendor or contract based only on price. While that certainly assures the organization of good fiscal sense, but it didn't always result in good contracts. Just because you sell the cheapest, ton of rebar doesn't mean it's the best rebar, or you know how to get it out to the bridge, or you're getting quality material. So we have added a provision in, and that is on page 161, item little b, capital D as in dog. It says, for written solicitation, factors other than price may be used to select a contractor. However, price shall be no less than 2/3 of the total consideration. So remember, before this year, it was 100% price. Now we're saying price is the predominant factor, but you have some flexibility to build a scoring or a ranking sheet as long as price is 2/3 of the consideration. That is something that I got feedback from a number of departments would be very helpful, because while they appreciate the clarity of going to the lowest price, they really didn't like being locked into the lowest price, knowing full well that was not going to be a good contract. So that gives us some flexibility. The last item I want to direct your attention to is on page 184. And it is item 2.725. Sole source purchasing. State law allows governments to describe a process wherein we don't need to go out for a bid, or we don't need to search for potential vendors or providers if we can demonstrate that a particular service or a thing that we'd like to purchase can only be provided by one vendor. There's always been confusion about whether the board has to approve this or whether the departments can approve this, and what's the process. We've always had something outlined in our code, but it hasn't been clear. What we've done here is we've said, okay, we're making a cutoff. If you believe a sole source is warranted and the price of that contract is going to be $100,000 or less, departments, you can enter into the sole source agreement and make that determination with county council's approval. So there is a little safeguard there. If, however, the value of that sole source contract is going to be over $100,000, the board needs to know about it, the board needs to approve it. So we built in a very clear demarcation below which departments can make the decision and above which the board has to. So that was something I put in and ran it by the departments, and they thought, oh, well, that makes sense. Hey, even the sheriff's office thought that made sense. And I only singled them out because it just so happened that before I got into redoing this, I think I had 2 or 3 sort of, and you guys saw them in the sheriff's office. And the question was, do we have to go to the board? So now they have. But those are the changes. Obviously, there are other changes, primarily to bring the contract manual and Benton County Code Chapter 2 back into alignment. Any questions?
I have one question. The shift from consideration of price alone and pegging it at that 67% or 2/3 of consideration, does that pertain to the over 150,000 contracts also?
Over 150,000, the solicitation creates its own scoring system.
Okay.
So price can be 2% or it could be 92%.
But it has to be stipulated in the request for proposals.
Yep.
And evident to all.
Yep.
And
Your
clarified
scoring-
online if we change
Your
anything in
scoring
that.
system is part of your RFP.
Yes, okay.
Yep.
Thank you. Any other questions?
Well, I appreciate trying to clarify and making what we're trying to do line up with what the rules are. So, and that change from price alone, I think, makes a lot of sense. The Highway 20 improvements in the Eddyville area come to mind.
Yes.
That, yep, they were the low bid, and it especially in that dollar amount, the providers know the game, and so it's a kind of a delicate balance, getting the best deal, but as we all know, that's not always just lowest price.
Well, and what we were discovering is, as you just pointed out, Pat, a lot of contractors know how to play the game, so they would deliberately submit a bogus, false price, low price, and then throughout the life of the contract, come in with change orders to get the price back up to where it really should have been in the first place. So we hope to avoid that in many cases. We've also made it very clear with one of the changes elsewhere in the agreement that you can amend these contracts within these price ranges, but you can't go over that threshold. So if you let a contract for $130,000 and the contract comes back and says, I need to add $40,000, well, that would push it to 170, which is above the 150 cap, and we're saying, no, you can't do that, because that defeats the purpose of that type of process. But it also, I will acknowledge, it places greater responsibility on the department to be more accurate in assessing how much they're going to need to purchase, how long the contract is going to go, and ultimately what the cost out of pocket is going to be, so they can more accurately use the right process for letting that contract.
My only other comment is with inflation, at some point, those numbers probably need to be adjusted.
So, Pat, when I got here, the threshold for no bids, no process, was $2,500. $2,500. And I remember Jim Burke coming to me and saying, Vance, I can't even buy a car for $2,500. I need to get cars for public works and health department. So we raised it to $10,000, and now we've raised it to $15,000, and everything else floated up. So you're exactly right. At some point, I'm going to come back and say, this just isn't working. We have a different number.
But, well, even if these are the right numbers, they need to be adjusted occasionally to
absolutely
be the same as they are now.
Yeah, only thing we need to be mindful of is moving that low threshold of 15 to so high that we eliminate process and the opportunities for other contractors to do business with the organizations. At the end of the day, the contracting requirements from the state are designed to create maximum opportunity for the maximum number of contractors to do business with government organizations. All right, I'll stop there.
Okay. Any further questions? Okay. Is there anyone who wishes to testify and speak to this new ordinance regarding county contracting policy?
I can't believe it.
You just did such a good job, Vance.
You nailed it, Vance.
Nailed the lane.
Okay. Well, then I will close the public hearing. And we will take a motion.
I'll move to enact ordinance number 2021-0303, amending Benton County Code, Chapter 2, and to conduct a first reading of the ordinance.
Second.
All in favor, please signify with an aye.
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 and I want Vance to read it.
You want Vance to read it, okay.
Second place.
That's perfectly fine.
As long as the chair is happy with that, I will do it.
Okay.
Before the Board of County Commissioners for the State of Oregon and County of Benton in the matter of amending Chapter 2 of the Benton County Code to update purchasing rules. Ordinance number 2021-0303, Benton County Board of Commissioners ordained as follows. Part 1, short title. This ordinance shall be known as Amendment to Benton County Code, Chapter 2, to update purchasing rules. So this will come back to you on a regular agenda item on August 17th, not a public hearing, to conduct the second reading. I will not be here, so I put your second choice. And then it'll go into effect 30 days after that second reading.
Okay, thank you for the reading.
I think the first reading is the important one.
You're not selling yourself as Ann.
Okay. Well, with that matter concluded, we are down to other. Is there any other business before the board at this time? Hearing none, we are adjourned.
Right.